Hello, my name is Blessing Okereke, and I will be presenting on asthma. So, what is asthma? It's actually hard to get a concise definition of asthma, and that's because asthma is seen as an umbrella term for a lot of clinical presentations. But overall, asthma is a chronic inflammatory respiratory disease of the lungs and airways um, with symptoms that are often episodic. In most cases, patients have obstruction due to a combination of inflammation, bronchospasms, and mucus productions. There's two different types of asthma. You have your allergic asthma and your non-allergic forms, such as exercise-induced asthma and occupational asthma. So exercise-induced asthma usually gets worse when the air is cold and dry. And then occupational asthma is triggered by workplace irritants such as chemical fumes, gases, or dust. Then you have your allergy induced asthma, which is triggered by airborne substances such as pollen, mold spores, cockroach waste, or particles of skin and dried saliva shed by pets, which is known as pet dander. So, symptoms of asthma include wheezing, which is that whistling sound when you breathe, sometimes when you exhale, sometimes when you inhale, sometimes both. A cough that's usually persistent, especially at night. Shortness of breath, which is that feeling that one can't get enough air in their lungs. And then chest tightness, which makes it difficult to breathe deeply, especially during cold weather or exercise. So, history of asthma. Asthma has actually been recognized and detailed detailed in academic works um, since ancient times, with early descriptions dating back to ancient Egypt and Greece. Greece physician Hippocrates described asthma using the word asthmino, which is a Greek meaning short breath. And this is associated to the gasping or panting during an asthma attack. However, it wasn't until the 19th century that the term asthma in itself was coined, and physicians began to differentiate it from other respiratory conditions. But from the from early to mid 20th century, this is when the most significant immunological advancements were made. Some of these include the discovery of histamine and its role in bronchoconstriction. Then you have the role of immunoglobulin E specifically and its role in allergy reactions. And lastly, the role of T lymphocytes and their cytokines in promoting airway inflammation and hyperresponsiveness. So epidemiology and social effects. Asthma actually affects over 300 million people worldwide and 25 million people in the US alone. In 2018, it was actually reported that an estimated over 1.6 million ED visits occurred and over 180,000 asthma stays in the hospital. So this map that I have here shows that cost it shows the cost per capita in 2012 for those affected with asthma, and the estimated cost was 732 million in just Washington alone, which comes out to about $1,000 per person affected. So as we can see, asthma is not cheap to treat, and that also feeds into why we see it, and it's more prevalent in areas where people are just lower income. So, along with this, asthma causes social and, as we talked about, financial problems. So, we see a disproportionate cost burden, as mentioned. As I just mentioned, the if you're a lower socioeconomic status, you likely are not treating your asthma as you should, which then causes you to miss work or school if you're younger. Um, um, but also, if you do happen to have to go to the ER because of an asthma attack, that affects your healthcare costs, which overall affects your quality of life. Just trying to balance one, not having enough money to go to the hospital or to fund your medication, but then having to or being forced to because you're having an emergency. So but it was also interesting in one of the articles that I read in countries with universal healthcare, they still found that there was a robust association with or between socioeconomic economic status and asthma, which is really significant because it shows that disparities in healthcare access, like we have in the US, doesn't necessarily fully explain the outcomes of why socioeconomic status is so important when talking about asthma or just other illnesses in general. So, causes of an asthma attack include air pollution, mold, pests, smoke, dust mites, and of course, all the other symptoms that I mentioned prior when talking about occupational asthma and the other forms of non allergic asthma. So, what happens during an asthma attack? During an asthma attack, the airways in the lungs narrow because the muscle wall of the lungs begin to contract. As the contraction happens, or continues, the airways become swollen and inflamed, while an increase in mucus secretion slowly starts to block the smaller airways. This process then causes there to be a slowing of the intake of air and ultimately the obstruction of flow of air. So, but despite all of this, the body still attempts to intake the same amount of air that it was before or prior to the attack, causing immediate tightness in the chest and leading to that breathlessness and wheezing and coughing, as mentioned before. So, diagnosing, there are three forms of tests to diagnose whether someone has asthma. So, the first one is the nitric oxide, and this one is where you breathe into a machine that measures the level of nitric oxide, and this is important because nitric oxide directly ties into a sign of inflammation in the lungs. Then you have your spirometry test, and this measures how much air you can breathe out in just one forced breath. So what happens is that you blow into the machine that measures how fast you can breathe out and how much air you can hold in your lungs. Lastly, you have the peak flow test, which measures how quickly you can blow air out of your lungs. And this one is done by a handheld machine that measures how fast you can breathe out. And you actually do this one for several weeks or over several weeks. And this is because we want to see if there's changes over time, just to prevent misdiagnosing someone with asthma or when they really have another form of respiratory illness. So then you have treatments. There's quite a few, but these are the main ones. And treatment does change over time. As mentioned before, or I'm not sure if I mentioned before, asthma can never go away, but it can be treated and kept like in check, I guess. So as you treat it, your medication might change, and you also might get different doses of different things. But the first one is inhaled corticosteroids, and this is the most effective controllers of asthma because these drugs suppress the inflammation that occurs during an attack. Then you have your bronchodilators, and these drugs are usually the first line of treatment that are given to asthma patients. Then you have your methylxanthines, and these are weaker forms of bronchodilators that are used to treat acute or more long-term asthma symptoms. And I put the theophylline because that is the most common form of methylxanthines that are given. And then you have your oral medications. These are sometimes needed, and this can also come in a form of an allergy shot. So, long-term effects. Chronic inflammation due to asthma actually leads to structural changes in the airways that are permanent. And this includes the thickening of the basement membrane, increased smooth muscle mass, and goblet cell hyperplasia, which then contributes to the persistent airway obstruction and overall decreased lung function. So, controlling the disease. In 1999, the CDC created a National Asthma Control Program, also known as the NACP, to try and stabilize the increase of asthma. This program had goals of reducing the rates of death, hospitalization, and just overall the limitations that come with having asthma, and was able to be promoted or added to 25 states and territories' health departments to accomplish these goals. And then we have other then we have other organizations that are tied, or let me correct myself, other organizations that are subcategories of the CDC, such as National Center for Environmental Health, National Institute of Occupational Safety and Hazard and Health, and there's some other organizations that the CDC works with, such as like Allergy and Asthma Network, American Lung Association, things like that. So, in conclusion, understanding the complex interplay between cellular and molecular factors is crucial for developing targeted therapies to manage asthma effectively. Therapeutic approaches are actually great because they aim to reduce airway inflammation and alleviate the bronchoconstriction to improve patients' quality of life and overall lung function. But despite all of the organizations that I just mentioned, and the medications, there's still a disproportionate rate of asthma in low income communities and communities of color specifically. One of the main reasons there's such a discrepancy is because of lack of effective medical attention, lack of funding, and overall just poor quality of life. When you consider how a lot of low income families are living in more rundown houses that have more of a risk of having the pollutants that trigger the asthma attack. So it is essential that all these factors that I just mentioned in the presentation are considered when developing asthma prevention and treatment programs, because substantial improvements for asthma outcomes won't be made without addressing all of these underlying societal processes that have created the large and persistent disparities in asthma outcomes. And that's it. Thank you for watching. I look forward to your questions. Bye.